Hello and welcome, everyone. I have a very special guest with us today, Shannon Cohn, who is a filmmaker, attorney, and social impact producer. I want to have just a full stop moment for a minute because her new PBS documentary, Below the Belt, is amazing. And I just brought the film for a screening to our little hometown in the Greensboro, Chapel Hill, Durham area last year. And I just sat and cried through most of it. It hits home for both of us, and we'll kind of go into our stories, balance that out with a few statistics because we want you guys to be informed. But before I do that, I want to welcome Shannon to the podcast and also give you just a little bit more information about how awesome she is. So one moment, please. Shannon is a filmmaker, lawyer, and social impact producer. She's worked across multiple continents. Her film and TV series, which are based on gender equity and combating stigma and taboo, have aired on PBS, Discovery Channel, Amazon, Netflix, National Geographic. Her new film, Below the Belt, is executive produced by Hillary Clinton and Rosario Dawson. And it's all about endometriosis as a social justice issue. And we'll get into that in just a moment. But it's part of a larger plan to create meaningful change in endometriosis and women's health, including research funding, policy change. You guys know that you hear me kind of harp on that all the time. It comes down to policy change quite often. And then medical education initiatives and widespread awareness. The film has been described by Newsweek as the first step in a plan for change, by The Guardian as Film of the Year. And before Shannon was a lawyer, she was a filmmaker, she was a lawyer and was part of the legal team that prosecuted Enron. Shannon has endometriosis, and in advance, just thank you for sharing that piece of information. And she also has 2 young daughters that have a 7 times increased chance of having the disease. Welcome, Shannon.
Thank you. It's an honor to be here.
Thank you so much for taking the time to be with me today and talk about this. And all the links that we'll mention, you guys, we'll put in the show notes, so don't worry about that. My first question is, I want to hear your story. What this shift from attorney into filmmaking, and what got you fired up about this topic?
Yeah. So, and I hope that our connection is good. If not, just let me know and I can repeat anything.
So far, so good.
So this film comes from a very personal place. As you say, I have endometriosis and I have 2 young daughters who have a 7 times increased risk. And the film came from a place where I wanted them to have a different future than what the path I had walked, which included, many years of not having answers, of being, really dismissed in different specialist offices and, primary care providers' offices who couldn't give me an answer to why I had these symptoms. And in multiple tests, surgeries, medications, chasing symptoms, basically. And not to mention multiple miscarriages and fertility issues. And the thought that millions of other people actually go through, that same journey. My journey is not unique or special in any way. It is something that is too often repeated, around the planet. And the issue with all of that is that all of this suffering, all of the expense, all of the, personal and professional relationships that are affected, are needlessly, suffering. And if people just were better informed about the condition, that healthcare providers are better equipped to recognize symptoms quickly, and that people who have endometriosis are empowered to say, something is wrong and we need to find an answer. And then beyond that, an understanding of how to approach the disease once you're diagnosed and how to find treatments that work for the individual. And we can get into that, but endometriosis manifests differently in different people. And because of that, from what we know, what works for one person to make, someone feel better does not work for another. This is a very individual disease, which is, confounding and frustrating because, you can't just find what it is easily, like you have a bacterial infection and, oh, that's what it is. It shows up quickly in a blood test. Oh, let's take an antibiotic. And then a few days later, you feel better. Mm-hmm. It's definitely not the case with this condition. But I mean, hopefully one day we'll be there, but not without a lot of work before then.
Right. And that's why I am just over the moon to have you on the podcast today to talk about that, because this film is seismic to me as a practitioner personally, with a long history of endometriosis in the family and, in my own struggles. Yeah, it feels nothing short of seismic. And I hope that, it already is making a big difference, but I hope that it is the start of something that can just be kind of a snowball effect to create awareness. Yeah. One thing that I'm really curious about, because obviously you're a powerhouse for change. What did you do? Like, what was the first step when you thought, I have this is my experience. There's a pause there between this is my experience and now I'm going to do this giant, amazing thing. What's the timeline in between, those two moments?
I first had symptoms of endo at 16. I didn't hear the word until I was 29. And then I believe I started making the film Endo What, which is the educational film we made just before Below the Belt. Mm-hmm. We started filming that in 2012. So a few years after that. So just a couple, and then, basically a decade of making these two films, Endo What and Below the Belt, and not just making the films, but building the social impact, the social movements, the social impact campaigns around them that aren't just about a film. I say the films are part of a toolbox, tools in a toolbox, and working with a lot of very talented, very smart people to put together a coalition, to push for change in a meaningful way. So yes, a multi-year journey, multifaceted, of which many collaborators played a part, and yeah, we're getting there. It's so complicated, but that's the power of storytelling and the power of film. It can break down, open doors and break down barriers where other, methods cannot.
Just to share a short snippet of my personal experience in bringing the film to our area, we were able to on Franklin Street in Chapel Hill, which if you follow UNC basketball or anything, you might occasionally see the enthusiasm for when we win games on Franklin Street. But on Franklin Street, there's a little theater called Varsity Theater, and that's where we hosted the screening of the film. And I'm just so thankful for it because we filled the theater. A, we filled the theater. B, we filled it with people who may have not shown up for just a random conversation, somewhere, because there's also a lot of stigma associated with pelvic pain and the way women experience it. And that night we had parents coming out, we had spouses coming out of, women suffering and people suffering with this. And then we ran a little local panel with, our local experts here, just talking about the things that we can do. And it did move the needle. And this is just a small example, right? It's just one example in a small town of what we did, and it's happening everywhere, which is what is so amazing. But I'm sure that it wasn't without some difficulties. And so one of my questions, one of my many questions for you is, in making a film like this and having a conversation that has been historically taboo, you can't talk about all the great things that are happening without talking about gender bias and some patriarchy and how our system is built and what it's done historically, because that's the thing that we're trying to change. Like, we can't just sweep that part under the rug. So I'm sure you can expand on that, but I know what my experience is as a healthcare provider. But if we could just talk about gender bias alone, in healthcare for just a second.
Yeah. Well, how I'm trying to think of like through what lens should I approach this? I mean, honestly, it's I think the first thing we have to recognize is that we live in a world that is built by men. And that's the way it
right, frankly.
That's the way it's always been. And for the foreseeable future, it is evolving. That is how it will continue to be. So we have to recognize that and find a way to operate within that paradigm, to challenge, of course, that paradigm. But I think first we have to recognize it in order to intelligently and in a nuanced way challenge it, Mm-hmm. So gender bias is a result of that construct, especially in the medical setting, where women, and I'm going to speak as women, as because endometriosis disproportionately affects people who identify as women, but we also know it affects gender expansive individuals as well.
Yeah.
But so sorry, my dog is coming to deciding she wants to say hello, and she's pushing the laptop.
Yeah, sometimes mine comes in and does that. I have a black lab.
She's just like, hey, you're talking to someone. You need to talk to me.
Yeah.
Anyway, so basically, gender bias is a result of that construct in which we live, where women often are taught to be unreliable witnesses to our own bodies. And that, we have to be aware of that and challenge it. And in the film, you'll see like Jenna, who is a character or subject in the film. She is a registered nurse, incredibly intelligent, articulate, but she realized as a person of color that when she went to the ER and explained her symptoms, she was taken more seriously. And this happened more than once. When she would take her partner, who happened to be male, a white male, he's actually a software engineer. So it doesn't even work in the medical field. She's a registered nurse. But she recognized that she was taken more seriously when he was in the room. And often she would even let him speak for her as a strategy, not because he was better situated, but she just wanted someone to take her seriously. So what does that say about the world we live in? When a very capable woman who works in the healthcare industry defers to a male partner. So I think that, it was really important to me to include that in the film, because I think it speaks volumes of, the situation and the landscape we find ourselves in.
Yes, absolutely.
And as we know, historically, women's health conditions have been undervalued, under-researched, largely dismissed in research. First, women weren't actually required to be part of research studies from the NIH until 1993.
And that deserves like a huge pause. Most women, when they come in to my office, for example, and we get into a little bit of that, like, why haven't I gotten help before now? Why has it taken me this long to get this help? And I talk about things like that. They're usually, their eyes get bigger. Like, really? I just thought women's health issues were always researched. And then there's just a big pause and a big silent no, for me, because that is the case. We weren't included in research. It had to be mandated that we're included in research, and we're still not being the issues are still not being well researched. One of the things that you said about we're being conditioned, we have been conditioned to be unreliable witnesses to our own body and health. I'd seen that in an interview that you had given before, and that phrase is so important. because so many women come in and sit down and they're not even sure about their own story and experience because they've frankly been gaslit in the healthcare system, which means they've been traumatized inside the healthcare system that they're supposed to be able to find safe sanctuary.
It's true. And so the first step, to combating that is to be aware of it and find a way to push past it, and really insist, in a healthcare setting that your symptoms are listened to and taken seriously, in a diplomatic way. I mean, even me, like I was in my GI doctor's office recently, and he was just like, "Oh, I just can't find the I was like, "Listen, we both agree that something is going on, and we both want to find the answer. We just haven't found it yet. So let's keep looking." But I remember thinking, okay, stay calm. Don't get excitable. Like, speak to him like this, like that we're partners. So I was using my best diplomatic, skills. But this was just a few weeks ago, and I still, like, even as someone aware of this, and taught and speaks about it, it is difficult in the moment,
It is. That's also worth a pause, because even though it's, it's a funny story as you tell it, it's actually very sobering and even, and angering on certain levels, because that's what we have to do. We have to think extra hard about what we're going to say and how we're going to present it in order to have it be accepted or said in an acceptable way, so that it's not, it's not that you're necessarily massaging an ego, but that's oftentimes what women end up having to do, is like work around the ego in the room to make sure that their lives are actually going to be attended to and their health is going to be valued, that they're going to be taken care of.
Right. There's just that knowledge and that awareness. And like Jenna did, by inviting her partner, it's kind of like, okay, we can outsmart the system. It's fine. I mean, yes, it's unfortunate that this is the situation, but at the same time, we also are used to like being practical and say, let's get this done. Like, let's solve this problem in the short term and the long term. So I mean, and I, as you know, and seeing the film, when people ask me about what the film is about, I don't say necessarily, oh, it's a documentary about endometriosis. I say it's a film about health equity, and it looks at taboos and stigma. It looks at gender bias in medicine, racial bias in medicine, institutional and financial barriers to care. What does it mean when there is a health system that is not built for the patient in this situation? What does it mean when a patient is relegated to subpar treatment because of financial abilities, to pay for medications or for surgeries, or informational systems, where there's misinformation or there's disinformation, or you don't have access to the right information. I mean, it's about all of those things, but it's told through the lens of a condition that affects, 200 million people on the planet, and that a condition that, that I happen to have. So, I mean, we look at all of these larger, expansive topics, and I think that's why the film works on a broader level, is because no matter who you are, you're dealing with all of those things. We are all dealing with financial barriers to care, especially in the US, but in really most countries, where no matter your age, your sex, your race, your socioeconomic status, you have barriers to the best healthcare, and that's why it was important to me to include different people from like different socioeconomic statuses, for example, who maybe there's somebody very wealthy, but at the same time, they still have barriers to information, to getting the information.
That's so very true. And I really appreciated that in the film, because it is such a broad topic that impacts everyone. You don't have to be personally touched by endometriosis to come away from that film and realize we have a long way to go to create the equity that we want for women and people who identify as women in healthcare, period. It's just such a massive plus that you're also tackled endometriosis, in the topic of the film, because it is such a huge problem. One of the things that I wanted to to spend just a couple of minutes on for the listener is kind of myth busting with endometriosis, because there's so many, there's so much misinformation out there. And if that can help clear up some things for women and those who are listening, that would be great. So I know you probably have a couple of favorite myths that you like to bust. I have a few faves. So what are your top ones that have been super helpful for you?
Well, I was in fact told that pregnancy would cure endometriosis by a healthcare provider,
Oh
a
my gosh.
well-renowned Manhattan-based OBGYN. He said, "Oh, well, when you get pregnant, all of that'll go away." I'm
Mm,
thinking, are you serious? I can't believe he just said that. I already knew it was wrong, but I was
mhm.
just like, really, you who's at this like the most prestigious hospital in Manhattan is telling me that? I couldn't believe it. So pregnancy is actually not a cure for endometriosis. That's an outdated myth.
True.
Another myth, I mean, likewise, hysterectomy does not cure endometriosis.
Correct. Yeah.
So a
Yeah.
lot of people, and even, for example, ACOG guidelines. ACOG is the professional association of the vast majority of OBGYNs in the country. The guidelines still say that hysterectomy is the definitive treatment for endometriosis, which is outrageous.
It is
Um,
pretty insane. And that brings up another important to myth, just go ahead and bust. And that's people assume that OBGYNs are trained and experts in treating endometriosis.
Yes, I
And
mean
they are
it
not.
is true, which is I understand. Hey, if I'm not familiar with this condition, I would assume, like a lot of
Mm-hmm.
condition, you kind of assume that that kind of specialist, that part of the body, like they should know, right?
Mm-hmm.
Well, that is not the case because again, endometriosis has been undervalued, under-researched, underemphasized in medical school. I mean, most doctors spend less than an hour on endometriosis, in medical school. And OBGYNs, the vast majority of them, and I think they will admit, they just do not have the specialized training and skill set to do advanced gynecological surgery, for example. Or, their focus is so broad and they're doing a great job on a lot of things like delivering babies, for example, clinical care, all of the things that we need. I see an OBGYN and she's wonderful and she has a really great skill set, but she would be the first to say, if you need specialized surgery, you need a referral. And I think that we can all a referral to a specialist, but I think we can the analogy is if you have good cancer, for example, and you need surgery, do you want someone who doesn't really do that surgery very often, doesn't really have that skill set, or would you want that referral to an oncologist who has specialized surgical training to remove that? I think we need that same pipeline of referrals for people who are indicated, that need surgery, instead of just trying to treat it in a clinical setting when that's tried and it doesn't work, then we need those referrals, to
Right.
people who treat endometriosis every day.
Yeah. Um, so our take home message really is, there are some OBGYNs who are specially trained in endometriosis, and you have to ask. You're not going to walk into any OBGYN office and find that in general they have training, or really any training at all in endometriosis. And ones that are upfront with you will definitely talk to you about that limitation, because they have so much other many valid things and diagnoses that they must cover. An OBGYN in many ways is a generalist for that entire area instead of a specialist. And a lot of people think of them as a specialist because we're so siloed in the United States in our specialties, which is both good and bad. It just sometimes means that some specialists don't end up talking to others, and then you end up getting limited treatment. And endometriosis is one of those where there are still some myths circulating. The ones you had mentioned and about hysterectomy as a treatment. It is not, the gold standard is also not, for those of you familiar with surgical approaches, is not ablation, it's excision. And a lot of people need to learn about that, because there is no diagnostic test other than surgery that can definitively tell you whether or not you have endometriosis. So
Yeah,
if you go to
not
the
yet.
ER,
I mean, I hope
not
that if
yet.
we can get, increased research funding and
Hopefully.
in a huge scale,
Mm-hmm.
that, one day soon we can have those non-invasive diagnostics.
Yeah.
But right now, I think it's important to say that surgery and, taking the sample of biopsy, to pathology and confirming it's endometriosis is the only way to definitively diagnose it. So a lot of times people say, oh, well, my MRI was negative or my sonar, my ultrasound was negative. That doesn't mean that you don't have endometriosis.
Right.
My MRI was negative and I had surgery shortly after and I had stage 4 endometriosis.
Mm-hmm.
So,
Mm-hmm.
the only way that a lot of times that those imaging will show up is if you have a large endometrioma on your ovary or large, really large lesions. But if you have, more diffuse lesions throughout your body, it may not show up on imaging. So just because your imaging looks quote unquote normal doesn't mean you don't have endometriosis.
Yeah. So 2 points there. If someone ends up in the ER and the ED, if you end up in the ED with pain, and that's often what happens, you can't handle the pain anymore, you've been ignored, your concerns kind of marginalized, or and then you end up in the ED because you don't know what else to do. There's not a diagnostic test unless it is large, and still that's not kind of commonplace. There's not a diagnostic test they're going to be able to do in the ED to tell you absolutely anything. So you'll get patted on the shoulder at best and sent home with pain meds, but it's not a treatment, which means next step is to find the practitioners that you need. Fortunately, there are a few websites that can point us in that direction. We'll include those in the show notes for you. But the other point to make about, the pain part of that and the identification of it and surgery being the gold standard for diagnosis is a lot of even well-meaning practitioners still think that it's just period pain or it's just lower abdominal pain. Or I even had an OBGYN say, well, your gut health and function has nothing to do with reproductive function, and then one is not going to impact the other.
Yeah. Yeah,
which is also not true. So it's not limited to lower abdominal pain. Endometriosis can be in lymph nodes and tissue. It can be in the respiratory diaphragm. It can be in the lungs. It can be in the nerves, in the pelvic nerves, the sacral plexus. It can be in a number of places, which means widespread pain that's not limited to the pelvic region. Mm-hmm. Any other myths out there that we should bust before we? Those are several of them.
Pain is not normal.
That's true.
That's what I was as a teenager just told that my symptoms were normal, part of being a woman. I needed to suck it up. All of those things I was told, and I remember being very confused by that because I couldn't fathom the fact that it would be normal. So yes, some people have a bit of cramps, but if your pain is so intense that it stops your daily activities, then that's not normal. If you're popping ibuprofen and going through supporting Advil and other types of drug manufacturers trying to get through pain, that's not normal. So you really need to see a specialist on endometriosis, or pelvic health specialist, because something's not quite right.
Yeah. And there's a lot that can be done conservatively, which is super important. That's where I end up focusing my time, is either pre or post-op, helping women manage things, because endometriosis is dependent on estrogen, very estrogen driven. And so there are a lot of environmental influences where you may be getting what we call endocrine disruptors, or estrogen dysregulators that are artificially regulating in a way that we don't want estrogen, which can actually make symptoms quite worse or create more growth when we don't. So there's a lot of things that can be done conservatively, which is good, because while surgery is very important and absolutely the gold standard, excision surgery, there's still a lot of things that can be done to improve your quality of life, help you get back to what you want to do, and really thrive in terms of pelvic health. So good news there too.
Yes.
I know we could talk about this for a long time. One of the things that I wanted to mention, if you're a listener, is if you are interested in what you can do to increase awareness and support, there is a bill in Congress that our Academy of Pelvic Health, on a task force that I was privileged enough to be a member of, that we helped co-write a bill for the House of Representatives in Congress a couple of years ago. It's HR 2480. And if you're interested, all you have to do is reach out and email your Congress member and say, hey, consider co-sponsoring this legislation. Because in doing that, it will increase awareness for pelvic health and increase the chances that women will be properly screened for this and other issues like just prenatal and postpartum, because we don't have any standards of care in the US, which is also worth a big pause. But anything that we can do to increase awareness and get women to the right place to get help would be wonderful. So we'll drop that into the show notes as well. And all right, a couple of last kind of rapid fire questions for you. One, what's something that you would like to see to change, for the future in terms of, based on what we've been talking about with endometriosis care, what's one thing that you would like to see change?
I would like for girls and women to be believed when they go into a doctor's office and share symptoms.
Yeah, absolutely. And it would be wonderful too if we could get like a public health based class where everyone graduated from high school understanding how their body worked, and that period pain is not normal. That would be wonderful. All right, last question. What book are you reading right now?
Let's see. Well, I have actually a stack of books on my nightstand at the moment, and depending on what mood I'm in is the one I pick up. I am reading The Body Keeps the Score, which I think is really interesting.
Yes.
Because I do think there's a lot of trauma, in all of our lives that manifests physically, so I'm interested in that. And I'm also reading, this is my fun book, is The Wager by David Gran. He wrote Flowers of the Killer Moon, and it's very interesting. He writes kind of narrative nonfiction. It's really good. That's my beach read. That's my fun when I want to just really go into a different place.
Thank you. I am like you. It depends on what I want. I'll pick from my stack on my nightstand too.
Yeah.
Thank you, Shannon, so much for spending this time with me today. Thank you for the advocacy work that you're doing and continue to do. And I think that it's a very hopeful situation that we have for the future. Thanks to your work and everyone on the team, because I know that took a big village to make this happen. So thank you so much.
Thank you. It's been an honor.